Inside the classroom at Burrell, Dr. Mike Woods reveals what makes our academic programs unique and prepares future doctors for success. What's the difference between a DO and an MD? Discover the unique approach of osteopathic medicine and why it's changing lives. That's coming up. From textbook to the table, take a closer look at Burrell's cutting-edge anatomy lab and how it prepares students for real-world practice. That's just ahead. Managing med school and money, expert advice on financial health for future doctors. Stay tuned for tips you don't want to miss. Learn how local doctors and students are hoping to educate our political leaders to help them understand how to overcome medical personnel shortages. All that and much more. So let's get started. Hey everyone, welcome to the DO Pulse, a podcast about osteopathic medicine, community, and education. I'm your host, Sidney Alvarez. Now this podcast is brought to you by Burrell College of Osteopathic Medicine and sponsored by GCU. Learn how GCU is the credit union that can help you meet your financial goals. Visit gcu.com for more. Now, medical school is no small challenge, but here at Burrell College of Osteopathic Medicine, students are set up for success from day one. Dr. Mike Woods gives us an inside look into what makes our academic program so effective. Take a look.
Hi, my name is Michael Woods. I'm the Associate Dean of Academic Affairs and an Associate Professor of Pathology here at the Burrell College of Osteopathic Medicine. Today, I'd like to give you a brief overview of our curriculum and what you can expect as a student at Burrell. So our curriculum is divided up into the preclinical curriculum and the clinical curriculum. The first 2 years of the curriculum is a two-pass systems-based curriculum. In the first year, we focus primarily on normal anatomy with using cadaver-based dissection, both our Las Cruces and Melbourne locations, where our students work with our anatomy faculty on an actual cadaver to explore and learn the basis of human anatomy, as well as normal physiology, teaching the principles of clinical practice, osteopathic manipulative medicine, as well as our mission medicine curriculum. In the second year, we move on to focus on pathology and pharmacology and the basis of clinical reasoning. The clinical curriculum in years 3 and 4 is where you learn to become a doctor, working with our preceptors and the basic core clerkships of internal medicine, family medicine, pediatrics, and others, as well as elective clerkships of your choosing, before going on to graduate and move on to residency. One element of our curriculum that makes us really unique is the mission medicine curriculum. This includes didactic elements on humanism, biostatistics, epidemiology, and the social determinants of health. So we also send our students into the community to work directly with nonprofit agencies, with school districts, with other organizations that are working with members of the community so that our students can get an appreciation for the other aspects of life that influence their patient population's health. Some of the opportunities our students have that are also unique include a distinction in rural medicine for those students who rotate at some of our rural regional academic centers, as well as a distinction in research as an option for students who want to make research an integral element of their education. Some of the opportunities in research include summer research experience during the preclinical years, as well as ongoing research opportunities during the clinical years with our preceptors. Some students go on to earn the research distinction. Many of our students end up presenting their research at national meetings where they get to interact with their peers as well as those that they hope to work with one day. We're really lucky here at Burrell to have access to some exceptional research facilities where students can do traditional lab-based research as well as human physiology research and research related to osteopathic manipulative medicine. We're also really fortunate to have a unique relationship with 2 research universities, New Mexico State University in Las Cruces and the Florida Institute of Technology in Melbourne, which have expansive research programs that create really unique opportunities for our faculty and for our students. So we are one college, 2 locations in Las Cruces, New Mexico and Melbourne, Florida. Our preclinical curriculum includes elements of both asynchronous content as well as synchronous delivery between the two locations with faculty at both locations who are working closely together to bring you the best quality education you can get.
That's great information, Dr. Woods. Thank you so much. Now, what exactly is a DO and how does their approach differ to medicine? We explore the world of osteopathic physicians and the unique impact they have on our patient care. Watch this story with Dr. Shiba Tano.
Hi, I'm Dr. Shiba Tano, and I'm an assistant professor here at the Burrell College of Osteopathic Medicine. Today I'm here to speak to you about what is a DO. So a DO is a fully licensed physician who has the ability to practice medicine in all scopes of training alongside of our MDs. We are able to diagnose and treat conditions, we can prescribe medicine, we can deliver babies, and we can perform surgery. So while in school, a DO physician receives training in osteopathic manipulative therapy, which essentially is hands-on techniques to not only diagnose, but treat certain conditions that affect patients. The benefit of having that additional hands-on training is that we are able to treat patients without necessarily leaning on medication or surgery. A DO also receives a holistic approach to medicine in training. We're very mindful of how a patient's environment, their mental health, their nutrition, how all of that can impact a patient's health, and so we're going to be considering that as we treat our patients. So what are the benefits of seeing a DO? A DO from the beginning has the training to think about how we can get you back into alignment or in balance. We'd like to think about what are the things that are challenging in your life. We want to consider all of the stressors in your life, all of the components that make you you, to try and see if we are able to mitigate the things that might be taking away from your life and enhance the things that can benefit your life. And so again, we would be mindful of things that are affecting you, and so we're going to question you about those, and we're going to be less likely to reach to our prescription pad to write you a medication. Another benefit of seeing a DO is our emphasis on preventative health care. Again, being able to talk to a patient about their diet, what types of exercising are they doing or not doing, this all takes into account how we want to prevent illness, and that is a benefit to a patient. Our education and our training is equal to an MD. We go to medical school just like an MD. We complete internships, residencies, fellowship training just like an MD, and we complete board certification in our specialties alongside our MD colleagues. So if what I said interests you, if you're interested in whole patient care, if you're interested in preventative medicine, and if that type of caring for patient appeals to you, I strongly encourage you to take a look at what osteopathic medicine is all about. If you'd like more information about osteopathic medicine, go to burrell.edu.
That's great information, Dr. Tano. Now, when it comes to learning medicine, hands-on experience is key. Burrell's Anatomy Lab gives students an incredible opportunity to prepare for their future. Here's how they're making it happen. Check this out.
Hi, I'm Dr. Steven Ontiveros, and I'm the Chair of Anatomy and Cell Biology, and I'm a founding faculty member at Burrell College of Osteopathic Medicine. Our curriculum integrates anatomical sciences with clinical relevance, and this is very important because it helps to improve the students' overall clinical reasoning skills. Students early are exposed to full dissection within the gross anatomy lab. It helps to improve their overall confidence and understanding of the anatomical sciences. In addition to that, we also integrate various types of imaging modalities such as ultrasound, and this helps students correlate clinical imaging with the anatomical structures that they've learned within the gross anatomy lab. Considering the gross lab, the students engage in full cadaveric dissections early within their medical school career. And so this is very important because it helps students develop a deeper understanding of anatomy when compared to learning anatomy in a two-dimensional approach. While dissecting, students gain this three-dimensional aspect of understanding anatomical structures, and in the process of that also develop tactile understanding of these structures that they're working with. And so when you consider these two components, understanding these are critical for the importance of functional relationships and how that is important for their overall clinical practice. So in the gross anatomy lab, in addition to learning structural elements, they also gain and learn ethical elements. And with respect to this, they learn, because they're working with bodies, they gain the aspect of respect for donors, which is really important because it helps them gain a stronger appreciation for the human body in general. And both of these are very important aspects, and both translate into developing compassionate future physicians. In addition to the ethical elements, students develop professionally through developing not just the respect for the donors, but also a sense of responsibility and team collaboration. Now, with respect to the lab structure within the gross anatomy lab, we have 2 gross anatomy labs, one located at each location, one in New Mexico and the other one in Florida. We have a total of 22 gross anatomy labs, 10 occurring here in the fall and 12 in the springtime. Students are organized into rotating groups of no more than 5 students per group, and this is very, very important for maximizing their overall interaction with each other, with their peers, as well as the faculty that are teaching within the gross anatomy lab. So I'd like to say that we have an amazing team, and I'm very proud of all the team members that are part of the department. One thing that I'd like to say about the department is it's a very dynamic and seeks continuous improvement. And what I mean by continuous improvement, that we're always looking for aspects to improve in some way or another. It helps to build an overall meaningful educational environment to make them more suitable and competent future physicians.
That's awesome. Thanks, Dr. Ontiveros. Now it's time for our first break. Check this out. Managing med school and money, expert advice on financial health for future doctors. Stay tuned for tips you don't want to miss. But up next, learn how local doctors and students are helping to educate our political leaders to help them understand how to overcome medical personnel shortages. That's after the break.
Here's to the unseen late nights, learning curves, and your perseverance. The behind the scenes is where the magic happens. It's where you shape your process and where you don't let anything hold you back. GECU is there to support you through it all with the products and services that you trust, so you can focus on making your own path. Become a member online now at gecu.com.
I got it! I got it! We're going to do that!
Hey everybody, welcome back. Now the Doña Ana County Medical Society is holding listening sessions to help explore how local leaders can help recruit and retain more physicians. As you can see, I'm joined by 2 amazing folks. I'm joined by Dr. Jenna Williams. You're a pediatrician, is that correct?
Correct.
Awesome. And I'm also joined by first year student doctor, first year or
Second year.
Second year student Dr. Ana Maria Ancheta. Thank you both for being on the show.
Thank you for having us.
Thanks for having us.
Yeah, absolutely. So, Dr. Williams, can I start with you? Is that
Sure.
okay? So, can you give us a little bit of a snapshot of the physician shortage here in Doña Ana County, but also maybe pretty much how are we as far as trending throughout the country as well?
So there's definitely been a shortage of physicians across the country. However, in New Mexico, we've seen a 30% decline over the last probably 4 or 5 years in primary care physicians. What I tend to find is people will ask me all the time, who can I go to for a primary care doctor? And most of those doctors that I know have full practices. So we don't really have anyone that we can refer people to.
You know, so I mentioned at the top of this segment, these listening sessions. Tell me about these listening sessions. Why are they so important? What are we trying to accomplish?
So a few years ago, physicians within the community realized we really needed to work together to try to implement change. So we started getting a group together. We reorganized the Doña Ana County Medical Society that had pretty much sort of gone silent for a little bit. And then we started working and deciding, okay, what can we do initially to start making changes? And honestly, there are multiple things that need to change to improve healthcare in our community, but we decided to focus initially on the reasons that we see physicians leaving. And number one is there's a huge malpractice issue in our state, and number two is that there's gross receipts that physicians pay, and we're only one of 2 states in the country that are required to pay this. So we see physicians leave because they have better opportunities in other states.
So what we have these listening sessions where
Yes.
we're here, we're learning about these challenges that our physicians are facing. We get this information and we want to share it with our stakeholders, our business leaders, our political leaders, and what?
So we're hoping that we can educate the public into our concerns so that then they can reach out to legislators and let them know how they can create change to keep physicians in our state. The other benefit of the listening session is really to better understand what type of issues people, I say patients, are having locally, because as I mentioned, we're going to only add to that list of what we can do to help improve healthcare.
Now, you got boots on the ground, so to speak. You're a pediatrician.
Right.
You're seeing this happening right in front of you. How is it affecting you personally?
So I came to Las Cruces in 2001. In the 24 years that I've been here, there are 29 pediatricians that have either come and practiced for a little bit, moved on, or retired. Right now we have actually 9 pediatricians in the community. And I just feel that leaves us so underserved, because in general as a pediatrician, you're not just running a practice, but you may be helping with an autism diagnostic team or a cleft palate clinic, so serving other needs for the children in the community. What I also feel is in southern New Mexico, Las Cruces could be a hub to help with children even in Silver City, TRC,
Absolutely.
Gordo. And so I really would love to grow the number of pediatricians that could help care for our community.
So we're talking about care for the community and there's a shortage. How does this care impact those underserved communities where they're already facing, economical challenges or other type of challenges? Now there's a challenge of there's no doctor.
Right, and then they have to travel. And a lot of times I find they're traveling out of state. And really, honestly, that's why I think we were so excited when Burrell College of Osteopathic Medicine was founded here, because I think that will help us over time to really serve the community better and not send patients to other states.
Absolutely. I mean, that's a great segue into you, Ana Maria. Thank you so much for patiently waiting. Now, as a medical student, how do you see this issue of physician shortages affecting the future of healthcare in the area?
Being from the area, I've witnessed it firsthand. My own cousin had a congenital heart defect, and Dr. Williams' goal of having a pediatrician hub here in Las Cruces could have prevented her from having to travel to Dallas, Texas for care. As a medical student, I believe having the college here to help boost the physicians that are able to practice in the area can help address that shortage, but it is even more imperative that we can retain the physicians in those areas, and having loan forgiveness programs can benefit us to encourage and incentivize physicians to stay in practice.
Now, we had the opportunity to chat earlier, and you're from the area, you're from Anthony, New Mexico. So just like Dr. Williams, you see the challenges that are being faced locally by the community. Tell me about this.
So locally, I've had patients and friends and family that just can't get in to see a primary care physician. I myself had to call different offices to even just get primary care for my own health issues. A lot of my families had to travel to Tucson, Arizona, to Dallas, Texas, to even to Albuquerque to receive specialty care from the congenital heart defect to breast cancer care as well. Was
the lack of available care here in the community, your community, was that one of the reasons that spurred you to enter the field of medicine?
1000%. I really wanted to come back and give to the community in the same area that my parents and my grandparents tried to seek health care. It motivates me as a future physician to want to stay in the area, because I know that there's the medical society advocating for future physicians like me to make these environment better, for not only for our patients but also for physicians to practice.
So what's the goal? You told me, we chatted before, so you told me primary care. Why primary care?
So primary care, because My sophomore year of college, my grandfather was diagnosed with stomach cancer. And when he had that diagnosis, he was very unsure, very hesitant to speak with his provider about what was going on. And it wasn't until he really started to speak to a Latino Spanish-speaking physician that he truly let those walls down. He was able to discuss the symptoms that he was having, the irritable bowel, and fully feel that he could be heard and respected within his culture. And so to me, that really solidified that I want to be a physician so that way I can help patients just like my grandfather.
Ana Maria, thank you so much for sharing that. So from a student's perspective, what resources or incentives could encourage young doctors such as yourself to stay and practice in an underserved area?
Definitely student grants for tuition. Tuition can be a very big cost for students that are low income from underserved represented backgrounds. It can be very daunting when you don't have somebody within your vicinity or within your site that can be a physician and that you can too as well. And so having different student programs, mentorship, and grants, it can really incentivize students to pursue medical school. After medical school, having more residency programs here within the local area. We currently have Memorial and Mountain View, and those are two wonderful programs that I hope to continue to see that we expand into specialty care, so that way we can provide not only just primary care to our patients in the area, but also specialty care. And just loan forgiveness programs. New Mexico has a wonderful public service loan forgiveness program, and I would love for legislators to continue to keep funding that and provide us the incentive to stay in practice.
You know, thank you so much. Dr. Williams, I want to bring you back in. They're giving me the cue that we're running short on time. But let's talk about these listening sessions. We have a few scheduled coming up throughout the year. Tell me about them.
So again, it's really to have several physicians in the community talk to patients, educate them about what our big concerns are with healthcare, but also learn from them as to what they see their big concerns are. Because I really think it takes a bigger group to create change, and that's what we want to do to provide better healthcare.
Absolutely, and we have great mentors such as yourself and amazing students like you, Ana Maria. Can you all please just look at the camera and tell people how they can get more information, how they can get more involved? Whoever wants to go.
Well, again, you can look on the website for the Doña Ana County Medical Society, which is dacms.org. We have a community page that'll help educate you on what's going on.
And social media?
Please like us on Facebook at the Doña Ana County Medical Society and follow us on Instagram at DAC Medical Society.
Thank you both for your time. We truly appreciate everything that you're both doing. Thank you so much.
Thank you.
Thank you.
Sure. We'll be right back. Managing med school and money, expert advice on financial health for future doctors. Stay tuned for tips you don't want to miss.
Your time is now. Right here at the Burrell College of Osteopathic Medicine, we have a 99% graduate residency placement and more than 850 physician preceptors, plus a simulation department, gross anatomy, and research labs. We offer Mission Medicine, a community-based learning experience, with 2 campus locations, New Mexico and Florida. Go to burrell.edu and apply today. And remember, your time is now.
Hey everybody, welcome back to our financial health segment. It is tax season, right? And to help us learn a little bit more about VITA is Ruby Alvarez. You are the Vice President for Community Development. Welcome to the show.
Thank you.
So important. I mean, wow. When it comes to taxes, it impacts all of us. What is VITA?
So VITA is the free tax preparation program that we lead. And so every year, GECU leads this initiative. And what it is, it's free tax preparation for our community.
What does it stand for, first of all?
So it's a volunteer income tax assistance program.
Perfect. That is so cool. Now, where can our students get their taxes prepared in New Mexico?
So we have many sites, and so in New Mexico we have 2 sites. We have one at NMSU, and our second site this year will be at the Thomas Brannigan Memorial Library. And you can find more information about the times that we're open on our website, which is freetaxeselpaso.org.
And we talked about New Mexico, but in El Paso you also have quite a few sites too. I think you mentioned there's like 20 of them. They can get the information on that site.
Yes, we have over 20 sites. We've been doing this for many, many years. So again, on our website, you can find information. If you happen to be in El Paso, you don't have to do it in Las Cruces. You can visit our sites. You don't have to make an appointment. And so on our website, you can find a site near you, or if there's a day that works better for you or a time. They're all open during different times of the day or different days of the week.
Wow, very accommodating.
Yes.
Yeah. Okay, it's tax season, so what do we need to bring?
It's very important that you do bring the documents that are required so that you're ready when you go. And so original ID and social security cards are very important. Whether it's you and your husband filing, if you're filing with your kids, we need those social security cards for the kids. So those documents do need to be originals. And then any information that you need to prepare your taxes. So your W-2s, any forms that are mailed to you by IRS, your job. And so all the forms that you get in the mail, you can find a list of documents again on our website. freetaxeselpaso.org gives you can find the list so you can see in detail.
Perfect. Ruby, y para la gente que habla en español, obviously we have some help for people who speak Spanish.
Sí, también tenemos en español en todas nuestras sucursales para si necesitan ayuda en español, ahí estamos para atenderles.
Wonderful. Ruby, so what tax credits are available for students?
So we have some credits that are available for students. So we have the American Lifetime Credit that's available and other credits that are available. So it's very important that you do visit our sites so that you understand which credits are available to you.
Right, there's so many opportunities that we probably can't even think about or have enough time to talk about, but the professionals there with the group can help out.
Yeah, definitely. And a lot of times you may think like, oh my gosh, this is a student preparing taxes. And so we want you to know that they are certified by the IRS. And so they do get certified every year and they have to pass an exam. And so they get the certification, they educate themselves because the credits do change every year. And so it's very important that you come in and you understand what credits are available to you, because many times there's a lot of money that's left on the table by many Americans that are not aware of the credits that are available to them.
Can I just walk in or do I need to make an appointment?
So you don't need to make an appointment. All of our sites you can walk in, and again you can find they have different times, and so just walk in, bring your documentation, ask your questions, and we're there to serve you.
Do we need to be a GCU member to be able to use these services?
No, you don't. I think a lot of times too we get that misconception that you have to be a GCU member. You don't have to be a GCU member. You can come to any of our sites and we'll be there to serve you.
Does it help to be organized as you're getting prepared for doing your taxes, get everything together before we come see you?
It does help. It helps tremendously, because a lot of times if you forget a document and we're not able to complete your tax preparation properly, it just delays the process. So it's very important that you get your documents in order.
Awesome.
Again, you can find a list on our website, or if you have questions, it's okay to come in and ask those questions. We're here to answer your questions, but the more prepared that you are, the better that we can serve you.
Perfect. Can you look at that camera and tell folks where they can get more information?
Sure. Please visit our website, freetaxeselpaso.org. You can find a list of documents that you need to bring. You can find all of our sites that are listed in El Paso and in Las Cruces. So again, we're here to serve you. Tax season is here, and our prepared tax volunteers are here to serve you.
Ruby Alvarez, thank you so much, Vice President Community Development with GCU. We appreciate your time.
Thank you.
We'll be right back. Well, that's our show. If you have any questions or story ideas, you can send us an email to communications@burrell.edu. We'd love to hear from you. Also, you can follow us on any of our social media handles. Our handle is @Burrell College. I'm your host, Sydney Alvarez. Until next time.